Good evening. Good evening. And on behalf of One, I'd like to thank you all for being here tonight, both in this room and in the room nearby, where we're also joined by lots of friends and fellow activists and family. And sorry you couldn't all make it here into this room tonight, but we love you all in the other room very much. And also to all the thousands listening online. First, a word about this word, One. Why are we so excited about Living Proof? One's a global advocacy organisation that campaigns against extreme poverty. We've got over 2 million members, and recently 10,000 new members have been signing up every week. And I think we've got a few new members here in the room tonight. And maybe some more before the night is out. Who knows? We at One come from a long tradition of campaigning against the injustice of extreme poverty. From Jubilee 2000, Drop the Debt, to the Make Poverty History campaign of 2005. And tonight we're honoured to be joined by many leaders from these amazing movements, such as Richard Curtis and Emma Freud, One's co-founder Bono, and the heads of Christian Aid, CAFOD, Action Aid, and many other brilliant groups. There's a certain journey which I think all of us are travelling together, though our steps along it may be at times quite different. For whether it was a petition signed, or a white band worn, a prayer offered in silence, or a slogan shouted on the street, a fortune foregone, or legislation passed. In this country, it turns out, we're one in our desire to help the poorest end extreme poverty. I've campaigned with people around the world and seen great support on these issues in Europe and America. But the degree to which the citizens of this country support the fight against extreme poverty is something that makes me feel incredibly proud to be British. At One, we try to connect and inform similarly supportive citizens from around the world and bring them together at crucial national and global decision-making moments, turning up the volume for those voices too easily ignored so that at those key moments, the most powerful are forced to listen and vitally change policies. At One, we're not asking for your money, we're asking for your voice. And it's because so many of you have spoken over the years that debts were dropped. Smarter aid is being delivered with great results across the developing world. And it's in that same voice now that we need to share this great news, because the enormous irony is that so many of us don't know about these successes despite the fact we demanded them. We're excited about Living Proof because it fills this informational gap with inspirational content. And frankly, amidst the tough times we're in, we think it's okay to feel a little bit good about the results you will hear tonight, because you helped make them possible. For example, you really did help avoid 5.4 million deaths through your government's contribution to the Global Alliance for Vaccines and Immunizations, something I just found hard to pronounce and most of you haven't heard of. And yet you really did help save these millions of lives, yet you didn't know it. Of course, there are huge challenges and more to be done on trade, investment, climate, governance. But tonight we're going to celebrate and share the successes of smart, effective aid, and we hope start a little epidemic of good news. From Bill and Melinda, we will hear about the living proof of success in global health and agricultural development. And from Dr. Deborah Work-Zudi, we will hear how African leadership at many levels is really fighting corruption and driving results. But before I go, I'd like to leave you with a question to consider and perhaps chat about afterwards at the reception and tell us your thoughts. And that is, if our speakers tonight are right and these great results have been achieved, why don't we read about it more in the papers or hear it on the telly? Listen to it, see it on the telly. Why isn't this good news shouted from the rooftops and printed in the red tops? Is there something in our psyche, in our human condition, that stops this sort of good news from spreading? Someone once thought that smallpox was an inevitable part of the human condition, but medical innovation eradicated that disease as well as that false thinking. So please, let's get creative together about how to tell this good news, not for feel-good PR reasons, but for a really serious purpose. For if we accept this living proof, are we not then compelled to tell the world these efforts are working, and then go on and see what more we can do together? For if we get this partnership right, we can build on the living proof of progress to help the developing world accelerate away from extreme poverty, and not just move beyond aid, but also help lift us all towards a better, safer, sustainable future. Ladies and gentlemen, without further ado, for some profound and statistically sound storytelling, it's my honor to introduce Bill and Melinda Gates.
Well, good evening. I have to say that I'm a little relieved to have made it into the theater tonight because Bill and I absolutely love this science museum, but his favorite exhibit is right by the front door. It's the steam engine, and we often get waylaid there for at least 30 minutes. So I'm so pleased we made it into this part of the theater, this part of the Science Center, which is my favorite part, which is the IMAX. We're here tonight to talk about development, and I know that it's a little bit of a strange time to do that. We understand that you have very tough trade-offs coming. But tonight, we really have two messages about Britain's remarkable commitment to development aid. The first thing that Bill and I want to say is thank you. This country has a very long history of generosity. Now, Bill and I are a little bit somewhat new to this philanthropy. In fact, we've been at this about 10 years. But compared to Britain, that's not a very long time. The UK has been at this for a long time, and it's been a pioneer and an innovator in development. The British public here is really uniquely engaged in poverty. Save the Children was founded here over a century ago. Oxfam and other charities were founded right here. And you've had so many great events about poverty, everything from Live Aid to Make Poverty History to even Red Nose Day. So the UK public really sets an example for citizens around the globe to really join in this fight against poverty. The second thing, though, that we want to say tonight is that your decision to maintain this spending is a really good one. When aid is focused on poor people, when it's done properly, it works. That's why we invest both our time and our money on these development issues. We think it's one of the highest returns on our investment.
As Melinda said, we got started about a decade ago, and we came into this with a kind of business person's thinking. How could we have the least overhead? How could we have the most catalytic impact? How could we make sure that innovation and a full model of what was necessary was being brought to bear? We wanted to measure impact. We wanted to adjust quickly. And what we saw was that there were some incredible things that could be done. And we're really pleased with what's been achieved. We've been able to partner with DFID and many others to see that aid is making a huge difference. Now, when we think about aid, it's important to think about the magnitude of it. For the UK, it's about 1.1% of the whole budget, which is about a little over 0.5% of GNI. Now, in some ways, that's maybe less percentage-wise than some people think, but it is still a substantial amount of money. And so just like in our giving, you should have high expectations. What you're going to hear from us tonight is that the effect of this aid, which has gotten smarter and smarter over time, is both permanent and extraordinary.
Now, we hear two arguments from the skeptics, and I think these are worth talking about right up front. The first argument is that people really worry about, isn't a lot of this money lost to corruption? And we're going to talk about that more in depth tonight. Both I will and Dr. Zudi will as well from the Global Fund. But I want to take the other skeptics' criticism right up front, and that is, can we really break this vicious cycle of poverty? Because we all know that when parents are poor, it's very hard to feed their children. Their children are malnourished. They often don't get the vaccines that they need and that we take for granted in countries like the UK. The children end up sick, they can't attend school, and then they lack skills, so they don't have any means of lifting themselves up or getting a job. And people ask us, if they're really being honest, they'll come to Bill and me and they'll say, well, what good is it to save a child if they're going to starve anyway? What good is it to save a child if they're going to die from HIV or malaria? And these are legitimate concerns. Development is a very, very complex area. And I think for a long time, the world didn't address aid very effectively. But what we're here to tell you tonight is that as a world, we are getting a lot smarter about this development aid. We're much more focused on results. We're more focused on measuring the impact that these dollars are getting, and we're more coordinated. In fact, there's a meeting of the top 20 donor countries that's happening in Korea early next year. That's the type of meeting that wouldn't even been considered 10 years ago. So what we know is that when aid intervenes at very strategic points, it triggers what's called a virtuous cycle. Now, the virtuous cycle is a lot like the vicious cycle, but it works in a positive direction. And that is, if the parents are healthy, they can work, they can feed their children so the children are nourished, get their children vaccinated, the children are then educated, and they have the skills to either improve their farm, start a small business, join a small company, and that whole family can plan for the future. This is why we say the UK aid budget is having a huge impact. It's a positive impact that's going to build on itself from generation to generation. And now what Bill and I would like to do is spend a little bit of time talking about some of the real-life stories of where this impact is making a difference.
Well, let's start by looking at what I consider the most beautiful picture ever. It's not that one. Not even that one. No, not even that one. That's a good one. It's this one. Now, that's a chart. Some people wouldn't get as excited as I do about charts. But this one documents, I think, the greatest achievement of human endeavor. And this is that if you go back to 1960, over 20 million children died. But if you go forward to 2008, that number was less than 9 million. Now, during that time, the number of children being born went up by over 25%. And so what the numbers show is that it's less than half as many deaths, even though the total population of children under 5 was growing. Now, this is quite an incredible thing. And it really did happen because of generosity, because of innovation and the interventions you'll hear about tonight. Now, it's not just that deaths were reduced. Some other very important things came out of those investments. We'll talk about how it reduced population growth, but it also brought people out of poverty. As the population growth came down, as health went up, it changed nutrition. It changed the education. It changed the sense of possibility that these families had. In education alone, 50 million additional children are in primary school just since 10 years ago. And so aid has allowed people to escape these poverty traps. Now, one of the key tools that was used was the delivery of vaccines. And Melinda will explain that incredible story.
Bill and I are really considering the next 10 years what we're calling the decade of vaccines. In fact, we've committed $10 billion of our own money to vaccines in the next 10 years. And the reason for that is that just a few doses of a vaccine can protect a child for their entire life. And for most children in the developing world, that is the difference between life and death. Now, there's an incredibly moral argument for delivering vaccines, but there's also a very powerful economic argument. A modest investment in a vaccine keeps you from having to treat that child for a disease over the course sometimes of their whole life. So a single dose of vaccine, let me just give you an example, a measles vaccine, it costs 15 pence. 2 doses of a measles vaccine protects a child for their entire life. That's the investment. So in the long run, we know that healthy children grow up to go on and live productive lives. So in short, vaccines are a great investment. They have a very long record of results if you look back in history. In fact, one of the diseases that most of us don't even think about in the UK or the US or in European nations anymore is smallpox. Smallpox was completely eradicated from the planet in 1980. It's the only disease we've ever eradicated from the face of the earth. And what does that save us? It saves us from spending 850 million pounds a year to keep it at bay. That's what we don't spend anymore on smallpox. None of us get vaccinated for smallpox any longer. But let me give you a few other diseases since 1980. Tetanus cases are down around the world 85%. Diphtheria cases are down 93%. And measles cases are down 93% as well. Now, the measles story alone, I think, is an amazing story. Since the year 2000, deaths are down 75%. That means we went from 700,000 people dying a year of measles, we're now down to 200,000 people dying a year. That means 500,000 human lives, human beings, are alive because of this one vaccine. So I think it's worth taking a moment to reflect on what that means. Because if you're protecting a child with a measles vaccine or any type of vaccine, you're protecting the entire family. Children don't grow up to have an illness that prevents or stunts their development. Parents don't have to stop working on their farm or in their business to care for those children. They don't incur medical costs that wipe out their savings. And as a result, that family has a lot more money to invest in that child and in their family's future. So I think there's one more reason, though, for a major reason for protecting children with a vaccine. And that is when mothers are confident that their children are going to make it beyond their 5th birthday, they naturally start having fewer children. This was a great surprise to Bill and me when we got into this work, because when we first started working on this in the health area, we started with population stabilization. And when we realized mothers really would bring down the number of children in their family, when they knew that they'd survive into adulthood, and that the mothers could then, and the family could feed those children and educate those children, we said, my gosh, these things go hand in hand, what we're doing on vaccines and what's happening with the population. Now, around that same time when we learned this about population, we also read an article that surprised us. This article was something about a disease called rotavirus. Disease Bill and I never even heard about. It's the leading cause of diarrhea around the world. 500,000 children every year die of rotavirus. And in the US and in the UK, kids don't die of this diarrheal disease, but it's happening everywhere else around the world in developing countries. And because of that fact, kids weren't dying here, there was almost nobody working on a vaccine for rotavirus. But now I'm happy to say the world does have a rotavirus vaccine, and it costs just a few pounds to deliver it to a child. I'd like to show a short video of the impact that this type of investment has on just one community.
Three years ago, we had high rates of diarrhea and severe dehydration. We had so many cases that we would have 2 babies sharing one bed. And it was hard to lose so many of our kids to rotavirus.
My daughter's name is Scarlett Sarai Alvarez. She's my princess. We are here because she's sick. She's vomiting and has diarrhea. As a dad, I work to protect my kids, but sometimes I worry.
We started working on this in 1980. It took us about 10 years to figure out how to make the strains that ultimately became the vaccine. In 1990, we did the research and development over a period of about 16 years. And the trick is being able to get that vaccine from, in this case, this manufacturer in the United States, into the mouths of children in the developing world, and that's hard. Well, the rotavirus vaccine needs to be refrigerated. It needs to be refrigerated on the way to the country. It needs to be refrigerated while it's being delivered to the clinic. And then it needs to be refrigerated really right up into the time that it's given to the child.
When this vaccine arrived in Fantasma, the number of cases of diarrhea dropped. Today, we don't have a single child admitted into our rotavirus ward.
We are going home today. If she hadn't been vaccinated, she'd be a lot worse. She's 2 years old, and I hope she grows to be a strong and determined woman, a superstar. Right, my love?
So you've just seen the impact what this one vaccine has on the first community that received it. And now there are going to be so many more countries that get rotavirus, thanks to an alliance that the UK is involved with called the Global Alliance for Vaccines and Immunizations, something we all call Gavi for short. This is a public-private partnership that supports 72 countries getting existing vaccines and the introduction of new vaccines like rotavirus. The numbers that I showed earlier for the decline in cases of tetanus, diphtheria, and measles, those are happening because of Gavi. The UK is one of the biggest funders of Gavi in the world. Your money is saving lives every single day. With more help, Gavi can introduce rotavirus more widely, and it can also introduce another vaccine coming for pneumonia disease called pneumococcus. These two vaccines are the pillars for getting down these childhood deaths in the future. In fact, with these two vaccines, we can save 500,000 to 750,000 of children every single year. So we really have two goals. When Bill and I talk about the decade of vaccines to come, we think about delivering the vaccines that we currently have, getting them to the developing world much more quickly. And we also think, though, about creating new vaccines, a new vaccine for malaria or HIV. Gavi will help us get those out in those countries once we have them. Now, there's still one of the greatest vaccine stories, I think, of all time that we haven't talked about yet tonight, and that's polio. And Bill's going to tell you a little bit about that.
Well, polio is a terrible disease, and it resulted in the deaths of millions of children and paralyzed millions of other children. Now, starting in the 1950s, a vaccine was invented. In fact, two types of vaccines were invented and used very broadly in rich countries. And in fact, the disease was eliminated. And so today, when we think about polio, we think perhaps about an older relative who was paralyzed, or stories about how parents didn't want to send their kids down to the pool. It was 50 years ago when the UK started its vaccination campaign, and there hasn't been a case in over 30 years. But it's still out there. It's kept on paralyzing children in poor countries. And in 1988, the world took on the goal of eradicating this disease. It's a very tough disease to eradicate because a lot of people who get the disease and transmit it to others never show symptoms. And so it's a bit more difficult than smallpox was. But the decision was made that it could be done. We knew that if we could win, if we could succeed, that the amount of money we could save, because we'd no longer have to vaccinate people against this disease, would be gigantic. Now, the UK has been the second biggest government funder here. Over £5 billion have been spent. The UK has given over £500 million of that $5 billion. We've had a lot of success. If we think about the number of people who were getting polio back in 1988, it would be, we could represent it by the number of people will light up right now. So think of that as 100%. Well, we've done such a good job of reduction that we're down to the last 1%. So that would be, just one person having polio instead of 100. That's a big thing. But getting that last 1% is very difficult. We're down to 4 countries We started with 125 countries in 1988. Now we have Afghanistan, India, Nigeria, and Pakistan. But even there, we can see that the campaign is having success. This year in Nigeria, we've only had 8 cases, and last year we had over 300. This year in India, we've had 37 cases. Last year, we also had over 300. But we also saw this year what happens if we let off, that we can lose ground. Tajikistan, a country that had been free of polio since 2002, had 450 cases. Now, we were able to go in and wipe polio out of Tajikistan again, but because it was still there in Afghanistan, it spread across the border. And that will keep happening until we get these final 4 countries. The world really has what it takes to do this job. The vaccines, the surveillance, the laboratory tests, the social marketing to get the mothers to come. It's a phenomenal effort that has taken lots of great thinking and great energy, as well as the money put into it. And if we can have success with this, if over the next 3 or 4 years we eliminate those final countries, it will invigorate the whole field of development. In the same way that the smallpox eradication invigorated the campaign for vaccines, and it was really after that that we went after widespread use of vaccines. Here with polio, we'll get more than just the eradication. We'll get more than just the victory and the positive energy that will bring. We're also using this polio campaign to get word out about taking children in for vaccination. So for example, in Nigeria, where I was earlier this year, they're using this so that all mothers know they need to bring their kids in for vaccination, and so that their delivery system is very, very strong. And so what this campaign is about is more than just this one virus. Well, there's another important area in terms of cutting down deaths of mothers and children, and that's an integrated approach that Melinda will talk about.
So whether it's polio or rotavirus or other diseases, vaccines are one of the most important things we can do for children. But it's not the only thing. Vaccines are the miracle that helps us with children once they cross that 30-day mark, 30 days to 5 years of life. But if we're going to save as many children as we want to in the world, we really have to tackle that first 30 days of life, and we have to tackle maternal mortality. And for women and these newborns, that really means a continuum of care. Now, we're thrilled that the UK government is really leading the charge and that they're giving full attention to this whole range of needs. When I talk with mothers in the developing world, and I'm there, and I'm an anonymous person talking to them, I'm a Western woman in my khakis, and I'll say to them, okay, you're in this small clinic, about as large as this stage, and I'll say, what else are you not receiving here that you'd like to receive? I hear over and over again, family planning. They'll say, what happened to that shot that I could get 3 months ago that's now no longer here? What happened to those pills that I used to have access to? More than 200 million women would like access to family planning, but they don't have access to it. Now, as a woman, I cannot imagine not being able to exercise my basic right to choose when I have my children or to plan my family. Because when a woman has access to family planning, she can make a whole host of other choices about her life. She can choose where she's going to live, choose what she wants to do for a living. Sometimes she can even choose who she wants to marry. So after family planning, I think mothers need, or we know that mothers need several other things. And that is prenatal care. They need a skilled attendant at the delivery to save their life and their newborn's life. They need postnatal care, and they need to learn about nutrition for their young babies. Now, it's very challenging to deliver this type of care. It's challenging really at every step of the way. But I'd like to introduce a woman named Leah Kebede. She's WHO's ambassador for maternal and child health. And she's seen the challenge firsthand in her home country of Ethiopia, but she's also seen the progress.
It's 3 a.m. in a remote village in Ethiopia. A woman named Kumi is in labor. The nearest clinic is hours away, and her only choice is to deliver the baby on the dirt floor. Even though I grew up in Ethiopia, and I knew giving birth here was dangerous, nothing prepared me for seeing it firsthand. It's literally pitch black in there. The thing is, every time a woman is delivering in a place like this, her chances of survival, I don't even know how you survive. Not far from Kumi, a loving father named Alamu Amalo reads to his 7-year-old daughter, Amarech. Just 7 months ago, his wife hemorrhaged to death during childbirth. My wife was the love of my life, he said. Alamu now has to be both father and mother to his 2 little girls. He says he doesn't know what he's going to do. When a woman dies in childbirth, the whole family, the whole community feels the effect. And then there are the newborns. 1 in 32 babies in the developing world dies during the first month of life. Dr. Mulu Alam Gassasa is a neonatologist in my hometown, Addis Ababa. She works 7 days a week and sees thousands of babies a year. While giving a tour of the facility, she had to stop to resuscitate a baby girl, just 14 hours old. She was struggling to breathe. When asked the chances of the baby surviving, she held up her hand and said, 0.
When you lose one, you cry. In spite of everything we are doing, it's not easy just to lose a life.
But there are glimmers of hope. The Ethiopian government and global partners have recently launched new programs to provide pregnant women with prenatal care and clean and safe delivery. Because of those efforts, a trained birth attendant arrived in time to help Kumi deliver a healthy baby girl. She named her Idile, which means lucky day. If these efforts can grow, my hope is that one day soon, a healthy childbirth in my country will no longer be considered a stroke of luck.
So as you can see, conditions in a country like this are tough, but there's a reason for optimism, and that is these health workers on the ground. Since 2003, Ethiopia has opened 15,000 remote healthcare clinics, and I've been in many of these. And again, they're about the size of this little stage that I'm standing on. They're often 2 or 3 rooms at the very most. And Ethiopia's trained 35,000 healthcare workers. These health workers, often women, staff these clinics, and they visit mothers at home. They also live out in the community, so they understand what motivates the women and motivates the family. These type of frontline health workers are absolutely key in countries like Ethiopia, India, Malawi. In Ethiopia, the percentage of mothers with 2 prenatal visits has doubled since 2000. The percentage of immunized children has doubled, and the child mortality in that country alone is down 25%. Now in Malawi, one of the poorest countries in Africa, their child mortality is down 33% because of these health workers that they have also trained. And there are hundreds of thousands of families with optimism now about their future. So I have even better news. The surge in investment in women and children is happening now globally. And the UK is actually leading that surge. It's the top priority for this new coalition government. And the UK really pushed this issue at the G8 this year, and they got it on the agenda. The partnership between DFID is working to coordinate other investments between the US, Australia, and our foundation. We're all pushing on this issue together. Because we know that when you make these family investments, they have a ripple effect. Because if you have a healthy mother, she can have a strong family, she can bring up her community, and she improves the whole economy in the area around her. It's really quite incredible. Now, Bill is going to talk a little bit about another way to boost societies at large, and that is agriculture.
Every country that's developed has done so partly by improving its agricultural sector, making it so productive that there was enough food and nutrition for everyone, and freeing up workers to do other things. When you think about poor people today, it's important that your image of them be that of a farmer. Over 3/4 of the poorest people on the planet are people who work every day farming a small plot of food. Now, these farms are not very effective. They don't have good seeds, they don't have fertilizer, they aren't being taught best practices. So most of them are barely growing enough food to feed themselves and their family. And as weather becomes more unpredictable, or any piece of bad luck means that they're in very bad shape. So we need to improve their productivity. Now, about 50 years ago, for large parts of the globe, there was a big uptick in productivity. The malnutrition in 1970 was incredibly widespread. Over half the people in the developing world didn't get enough to eat. Today, because of advances outside of Asia, outside of Africa, the so-called Green Revolution has raised farm productivity so that malnutrition, although still a very serious problem, is down to 20% of people in these developing countries. Now, that Green Revolution taught us a lot. It taught us the importance of productivity. There were some things that next time around we can do even better, making sure we're thinking about excess fertilizer, thinking about the effects on all the different types of farmers, particularly the small farmers. There are reasons why this didn't reach Africa. The investments weren't there, the seeds weren't done for Africa, but now this is something that can be tackled, and it will make a dramatic difference. I first learned about this, the opportunity, reading a book written by Sir Gordon Conway, who's with us tonight. He ran the Rockefeller Foundation, and also he's been a key advisor to DFID on a lot of the agricultural things they do. By taking new science, by thinking through the local circumstances, understanding the needs in each of these African ecosystems, we can do something phenomenal. The new science is a type of innovation, and we're seeing it already in a few places in Africa. Ghana's a country that's done a good job putting 10% of their budget against agriculture, and over 25 years, they've achieved 5% growth per year. That's meant that hunger is down by over 75%. And so this is a country that will not only be able to feed itself, it will actually become a food exporter. A group in Africa that's working on this African Green Revolution called AGRA, headed by Kofi Annan, looks at Ghana and tells the other countries that if they follow those same practices, they can get those same incredible results. Now, part of this is creating new seeds. There's many techniques for creating new seeds. There's crossbreeding, there's genetic techniques, a number of things that, done in the right way, tested carefully in the lab, tested carefully in the field, really can not only meet what farmers want, but be incredibly effective environmentally and make sure that we're not putting acreage under farming that really shouldn't be pushed into that type of use. So it's a very positive thing. This is a case where sustainability and productivity really go hand in hand. One example of this is a new type of seed for sweet potato. It's a seed that increased the size of the crop and also added in vitamin A. So let's see how that seed changed one family's future.
Twakushukuru Bwana Yesu, twashukuru kwa mema mengi umetujalia Bwana. Twakushukuru Bwana Yesu, twashukuru kwa mema mengi umetujalia.
I was born here in Mwasonge. I am 43 years old and have 5 children and 4 grandchildren. I used to sleep on a rag on the floor with my children. Then I met One ID. One ID gave me new seeds and taught me how to farm this orange sweet potato. She taught me about soil irrigation, about crop multiplication, about dividing vines, the things we didn't know before. She also taught me about selling my crop. Customers ask me why my potatoes are different in color. I tried to explain to them that they are orange because they have vitamin A, which provides protection in the body and are good for kids and adults growing. So customers get excited and buy from me. Now we sell seeds, chips, biscuits, donuts, flour, and even pancakes, all made from sweet potatoes. I work happily knowing that I will be getting out of poverty by doing what I am doing. And when I sleep, all I think about is the potatoes. The dream is always the same: to finish the house I am building of brick stones, to sleep in a comfortable place, and to raise the standard of living for my children and grandchildren and send them to school. I am happy the sweet potato farming is helping my dreams come true.
Maria now is training other farmers and passing along those seeds so they can have the same type of opportunity that she's had. So we're always looking for where you can intervene to have big impact. As Melinda said, there's a vicious cycle that if you interrupt it, becomes a virtuous cycle. And there's many ways to do this. You've heard about health interventions that I'd put at the top of the list. You've heard about agriculture, but there are other things that can be done as well that are also very catalytic. DFID has a broad portfolio of activities. In the last year alone, they did an incredible number of things, including training over 150,000 teachers, which is very important. They vaccinated over 4 million children against measles. They trained 70,000 healthcare workers, and they provided safe sanitation for over 2.5 million people. So it's a broad set of programs and really impactful in a way that you deserve a strong thank you for your huge commitment.
So Bill and I would like to answer some of the other skeptic questions that we hear. And one of the questions that we hear, rightfully so, is, I'm worried about corruption. Doesn't the money just help dictators buy more mansions in these countries? And it is true that for a long time, governments didn't always measure the impact of these development pounds that were going in. And especially during the Cold War, really a lot of this development aid was used more for currying favor, quite honestly. But that's changed. In 2000, when the world really set out these Millennium Development Goals and decided that we were going to focus on extreme poverty, poverty reduction, it changed things. For example, one example is here in Britain, you no longer tie your aid. Well, what does that mean? It means that you get 25% more impact for every pound that you put in to development aid. So many countries now are really tracking their spending and they're measuring their impact from these dollars. And we want to recognize Andrew Mitchell because his leadership on accountability has already been fantastic. DFID's been great on this issue, but they've committed themselves to getting even better. And I have to say, Bill and I know a lot of the other partners that we talk to, look forward to this work on impact evaluation and learning from what DFID will do. Now, another way to measure impact is to talk about something called the Global Fund. The Global Fund was created to fight AIDS, tuberculosis, and malaria. And we have great data about the Global Fund because the Global Fund hires accountants and they let themselves be audited. And they've actually cut off funding when they find out the money is not spent effectively in a recipient country. The Global Fund was created 8 years ago, and it's already led to major advances. I think the Global Fund is one of the kindest things human beings have ever done for one another. The UK has invested £1 billion in the Global Fund. And here's what your money's gotten so far. There are now 2.8 million people on antiretrovirals for HIV/AIDS. This is 2.8 million people that would not be alive tonight if it wasn't for your investment. In tuberculosis, 7 million cases have been diagnosed and treated because of the Global Fund. In the area of malaria, 122 million bed nets have been distributed. Now, when you combine bed nets with indoor residual spraying and treatment as well for malaria, you start to see major case reduction. Rwanda, cases of malaria are down 45%. Cambodia, malaria cases are down 50%. Zambia, cases are down 50% of malaria. And in the Philippines, malaria cases are down 76%. When somebody doesn't have malaria, they can continue to work. And they also don't have to go home and try and help their child if their child has malaria. This is a very clear return on investment. Now, don't just take my word for it. I'd like to introduce Dr. Zudi, who's the Executive Deputy Director of the Global Fund. Dr. Zudi?
Thank you. Good evening. It's a pleasure and a privilege for me to be here and to be an example of living proof, and to show to you that aid is indeed effective and we are making a major impact. I'm Ethiopian. I was born in the eastern part of Ethiopia in Harar, and I went to a state school where we were given milk from UNICEF every day. For most, that was the only meal of the day. Another aid agency will be spraying houses so that they kill mosquitoes and we don't get malaria. Milk and DDT, that's what it takes to save lives in some parts of the world. I studied clinical immunology here in London at St. Mary's Hospital Medical School, and over the years I've been privileged to lead institutions in my own country, in Ethiopia, bilateral programs in Africa, and global HIV/AIDS programs at the World Bank, UNAIDS, and now at the Global Fund. But I'm talking to you as someone who has seen the devastating effects of these epidemics. I was a member of the group that identified the first Ethiopian AIDS patient, a young girl of 24. She was so frail that she was carried to us by her sister, who was only 23. There wasn't AIDS medicine there. With what we had, we treated her opportunistic infections. It did show some effect, but it wasn't long-lasting. Every time I see someone on antiretroviral treatment today, I can't help but think of this girl and the millions who have never been given a chance. But today, thanks to all of you, we are able to provide treatment and prevent new infections. That's where I'm coming from. And it makes a difference, and this is living proof. Let me tell you a bit more about the Global Fund, building on what Melinda just said. In 8 short years, with the generous support from you, from all over the world, the Global Fund has committed £12 billion in 144 countries worldwide. 60% of these goes to sub-Saharan Africa. The results have been tremendous, and some impressive numbers of people reached by the Global Fund have been mentioned. What keeps us alive at the Global Fund is the daily contact we have with people who have a new lease in life today because of the support. 4,000 people with real lives, like yourselves and mine, every single day. Put very simply, it's about 10 times the number of people in this room today. Aid is effective. Tonight, I want to share with you some examples from our work in Africa to show that we have been effective because we have been able to respond to some of the skeptical views that have just been mentioned by Melinda. The first one is that there is too much corruption and little accountability in aid in Africa. And the second one, that aid creates dependence and is therefore not a sustainable solution. Let's take the first one. The statement you see on the slide is from our framework document. Please pay attention to the words transparency and accountability. And that's how we do business. What this really means is people in countries are in charge of their programs, and that's what smart aid is all about. We have routine mechanisms to manage risks, but more importantly, to prevent it from happening in the first place. And when it occurs, we take decisive action. So do governments. In connection with an ongoing investigation of Global Fund grants in Mali, the president of Mali, Amadou Touré, said, $1 stolen is a life lost. And he personally appointed an investigating judge who has put people who have not been able to account for the Global Fund resources in jail. Accountability, therefore, is something that the Global Fund and partners take very seriously. In Cameroon, a recent audit found the Global Fund grant was overcharged for commodities in the tune of about 2.1 million pounds. This is about 3% of the funding that goes to the country. The Ministry of Health committed to full payment, and within 6 months, we have recovered 84% of the resources. At the same time, the programs are running effectively. So yes, corruption does exist, but no, it is not a dead end for development assistance, as it is often made out in Africa. It's a challenge that Africans are addressing with full force in development assistance, in businesses, and in politics. We have to recognize that. There is a strong campaign for good governance by leading African figures, some of them board members of one, such as Ngozi Aiwala of the World Bank and Mo Ibrahim. And this leadership, not only by individuals, but by civil society, the private sector, the people who are infected and affected by these diseases, and institutions of government, is contributing to the broad sustainable development across the continent. That brings me to the second misconception, which is development assistance inevitably leads to dependence and is not sustainable. The Global Fund actually requires that countries, number one, put in their own money, number two, the Global Fund resources are additional, and number three, they go towards sustainable development in the countries. So these are requirements that the Global Fund demands from countries before we put any program in place. And this is an example of sustainable development. Let me give you an example. In Tanzania, malaria places huge demands on the national health system. 18 million cases of malaria a year in Tanzania alone. Resources from the Global Fund and other partners are being used to achieve universal access to long-lasting bed nets. As a result of this, malaria cases have been drastically reduced so that health facilities could be used for other diseases. In our recent replenishment in New York, pledges were made from Namibia, Nigeria, and South Africa contributing to the Global Fund, and also African private sector. This is more living proof that aid does not have to go forever. As an African, I can tell you that people who receive aid are the first ones to strive for sustainability. What they want is to be empowered. What they want is to be independent. But aid that creates dependency is bad aid, both for the giver and the receiver. In just 8 years, from 2000 to 2008, Africa has managed an impressive 54% increase in income per person, and poverty rates have fallen. 54% growth in 8 years is remarkable. Africa now has a $1 trillion economy with improving business, governance, increasing political stability, and a population of over 800 million, most under 25. The region is becoming more and more attractive as a market for international investment and as a trade partner for its neighbors. These positive developments are still young and vulnerable. With the right support and follow-through, Africa is on its way to become an engine of growth for the entire global economy. But without your support, the picture would be very different. Through aid, trade, and investment to build local capacities and further strengthen governance, we can make a difference. Young Africans realize that more than ever, the continent's future is up to them. They reach out to us on their new terms, and we must not limit them with our doubts and assumptions. Let's help redefine their future and our own. Working together, we can provide effective aid, and we can do more in the fight for better health in Africa. We can do more to fight poverty, illiteracy, diseases, hunger, and to build a stronger Africa for all of us. So a long journey from a young girl who grew up on UNICEF milk to witness the worst epidemic in the history of mankind, and to be privileged to become part of the effort today. 5.25 million people worldwide have a new lease of life because of AIDS treatment. I am one of many living proof that aid works. That milk from UNICEF must have done something good. And we have just heard and seen there are millions of people like me in Africa and all over the world who are proof that aid can be smart and is often effective. I'd like to take this opportunity to say thank you to the people of Britain, thank you, Europe, and together we can make a difference. Thank you.
Well, that was great. One of the things Dr. Zudi mentioned was the story of African economic growth. And that's something that I don't think is widely recognized. Now, that growth portends well for the future. Those are countries that are taking their economic success and investing in their own countries. But one of the reasons they were able to get on that path was that aid made a difference. It reduced disease, it increased education, it allowed the government to create a framework where it was tapping into its people's potential. And the private sector benefits from those healthy, well-educated workers. And that starts the cycle that we all want. Now, we've seen this in the past in parts of the world like Latin America and Asia. There has been a big transformation. A lot of the countries are either receiving far less or no aid at all. Now, let's look at a map of Asia here and look back in 1968. Now, what we've done is we've color-coded this so that the countries where aid is a high percentage of their economy, are either yellow, orange, or purple. So we see here purple is over 1% to 3%, orange is 3 to 5%, and then yellow, which is only one country, is over 5%. So that's a lot of aid. And this was a high percentage of the world's aid going into this part of the world. Now let's move forward 40 years and take a look at this chart at that point in time. Well, here you see a very dramatic change. You see very few countries still in those upper categories. In fact, India, as an example, moved from 2% down to 0.2%, so a tenth as much of its economy. You have some really phenomenal stories. Thailand essentially receiving no aid, even though it was a big recipient in the past. And Korea, the best story of all, actually going from being a recipient to now a significant aid donor. And so this is the kind of graduation that aid done well really allows to happen.
So history shows us that development doesn't have to be endless. And when money is spent wisely, it saves lives, it improves livelihoods, and it builds prosperous societies. Now, Bill and I think when you find a leverage point that's this powerful, you should take advantage of it. When we find a way to save millions of lives, we should do more of it. When we find a way to improve hundreds of millions of lives, we should give it all we've got. So when it comes to development, we are both optimists. We meet people on the ground whose lives are being transformed with the help of the investments of countries like the UK. And we often say to ourselves when we're traveling in the developing world, if people could see the impact and see the change on the ground that we could see, we think they'd be optimists too. In fact, just earlier this year, Bill talked about being in Nigeria, and I was in India, in a northern state called Uttar Pradesh, one of the poorest states in India. And I met a mother there named Rukmini, and I was there 6 days after she'd given birth to her daughter. And as tradition would have it, she stayed in the same dark room for 6 days. But on the 6th day that I was there, she was going to perform the ceremony there called Chati. And that is when she brings her daughter out of this dark room. So Rukmini dressed herself in a beautiful sari. She came out into the courtyard and was greeted by the villagers who were singing and drumming. And they sprinkled a few grains of rice on her for prosperity and gave her a few small rupees that they had. And what Rukmini did next was to take her newborn 6-day-old baby daughter, and she held this girl up to the sun to thank the sun god for giving her a healthy baby daughter. And I thought in that moment about the joy that I felt as a mother on the day that my children were born. You can't help but hold that little baby in your arms and experience that same joy. Because no matter who you are, no matter where you live, it is so incredibly moving to hold a healthy baby. And I thought in that moment, the progress that we are making in the world is going to change that baby girl's life, the trajectory of her life. And that's what we want for all the children around the world. So we call ourselves optimists. Even in tough economic times, the overall trend is that the world is getting better. But it's not getting better fast enough, and it's not getting better for everyone at the same rate. And that's why we sometimes say that we're actually impatient optimists.
In the spirit of impatient optimism, let's talk about what we can expect if we continue these smart aid investments. Let's look at hunger. A lot of good things happening there. For example, the 300 million Africans that depend on maize are going to get new varieties that are drought resistant and add productivity. If we take new seeds for maize and other crops, plus other new tools, microirrigation, government extension, better fertilizer supply. The opportunity with the investments that are being made is that we can cut hunger in half in Africa by 2020. Let's take health. In health, I think the key number is that child mortality number, the number that's just recently dropped below 9 million. I think within 15 years, we can cut that to below 5 million. Why is this achievable? Well, let's go through just some of the interventions that are coming forward. If we just took the vaccines that we have and got broader coverage, got up to 95% coverage, instead of with the birth rate going up a slight increase because you have more births, if we just add this vaccine coverage, we go from 9.3 million deaths down and get down to 8.3 million. So that's the first of 4 interventions, additional vaccine coverage. Second is we just take malaria. We don't assume a miracle, just getting the bed nets out there and the malaria drugs. If we do even better than that, if we have a vaccine, we can go further, but just the bed nets and drugs get us down to 7.7 million. Now let's take what Melinda talked about in terms of better care for mothers and children, teaching those birth practices, having the trained attendants, getting them to the healthcare clinics when they need that. That has another huge impact, gets us down to 6.3 million. And then the fourth and final thing we'll assume is that those new vaccines, the vaccines for some of the diarrheal disease and some of the respiratory, the pneumonia disease, that gets out there as well. And that gets us down below 5 million. So it's a roadmap, a pretty straightforward roadmap for saving 4 million children a year. Now, if we look at the trend in 2009, we are on track. That was a very good year. There was a good reduction. So even in the first of those 15 years, we can see it can be done. And there are many things we're doing even beyond those 4 things. So perhaps that goal can even be beat. Remember, it's not just those lives. That alone would be an incredible thing. But it's reducing sickness, it's stabilizing the population, it's allowing those communities to focus on education and economics. So it really is a phenomenal goal, but within our grasp if we continue our generosity.
So for us, it's great to be here in the UK. The commitment that you all have to these issues really totally and completely inspires us. We invited you here tonight to show you some of the proof, the living proof of what we see when we travel around the world. I hope you've seen a little bit tonight that learning about these issues has been a lot of fun for Bill and me. In fact, we often say it's been quite a journey for the two of us. And sharing the stories is actually really quite gratifying. And so we hope you feel the same way and that you'll share a little bit about what you've learned tonight and the stories that you know from any work that you've seen or travels that you've seen on the ground. Tell people, though, about the incredible number of lives that have been saved because of the UK investments. Tell people that we know more lives will be saved in the future, that eradicating polio is absolutely within our grasp. We are right there on the last cusp of it. Please explain to people how donors are getting smarter and how aid really turns entire economies around. When we think about what's going on around the world, I think there's something really noble in human beings' desires to help one another. And I think for us, it's really exciting to know that the world knows how to tackle so many of these issues. And if we continue to invest in development, more people's lives are going to get better in the future. So we thank you for your leadership. That's what we're really here to do tonight. It's helped so many people. And we're amazed when we think about how many people it's going to help in the future and how much better their lives are going to be in the future. Thank you.